The skyrocketing costs of prescription drugs and the rise in teen vaping continue to make headlines both nationally and in Minnesota. Joining me to offer his perspective on measures to address these concerns is physician and Senator Matt Klein. Thank you for being here.
Thanks so much, Shannon.
Let's begin with prescription costs, because the Trump administration proposed a rule change over the summer that would allow states to enact plans to import drugs from other countries like Canada that have lower prices. A handful of states have done this. Is this something that Minnesota should do?
I think we should fix what's wrong with drug pricing in America and in Minnesota and not try to go around the system by getting drugs from Canada. I have worked very closely with Republican Scott Jensen, the other physician in the legislature, on some sort of drug pricing oversight commission, similar to the Public Utilities Commission, where we could investigate if the cost of a certain medication, like an epinephrine pen or insulin, for example, went up by 400% in a year. This commission would be charged with looking into that. Is that cost justified? Is it comparable to market rates? And if it's not, if it's gouging or extortion, then they would have some power to punish or impose penalties on that. I think that's the only way we're going to get to the bottom of this type of balance between the for-profit drug manufacturing industry and the needs of humans in Minnesota to receive necessary medications.
This week, by happenstance, an ad came through one of my social media feeds from pharma, making the point that America leads the world in medical innovation and producing half of all new medicines. And medical innovation isn't cheap. Some of these drugs cost billions of dollars to develop. And so I would assume that they would argue that there's some recouping of their cost that needs to be done. So how do you balance that innovation with prices that people can afford?
That's the fundamental question. And as a physician, I am incredibly grateful to the pharmaceutical industry because they create the miracle drugs that allow me to do my work and save Minnesotans. And without them, without their sort of drive for innovation and profit, candidly, we would not have those innovations, and those are great drugs. The problem is, and they quite appropriately are driven by profit to manufacture and generate those things, and then once available to drive up the price as high as the market will tolerate. But once those drugs are available, as a society, we have a moral obligation to make sure those drugs are available to everybody, regardless of income or means. So how do you balance those two imperatives, Shannon? How do you balance a for-profit industry with our social obligation to our own citizens? And again, I think it's by creating some sort of oversight board that reconciles those two imperatives and tries to find a middle ground.
Do you believe that the new legislation that will come online soon that will shed a light on the PDMs, the pharmacy benefit managers, do you think that will make an impact in the future?
I do. So that's one step in the chain. It's not a complete solution, but it at least shows that the legislature in a bipartisan way is serious about people who are sort of driving up prices within the drug delivery system. PBMs are one sort of secretive institution that not a lot of people know about, but they are a middleman between your doctor and your pharmacy, and they do contribute significantly to costs. So we've made some steps to sort of shine some light on their practices.
What do you tell patients that are struggling to afford the medications that they need?
You know, sometimes there are some very hard conversations, and I can't tell you that I always have an answer for them. We do the best we can with charitable care and with in my work at the hospital, discharging people with supplies, but there are some times where you have very real and very honest and very unfortunate conversations with patients who simply can't afford the necessary medications, and we don't have a good solution as a society for getting them those medications. And of course you saw it with Alec Smith, who couldn't afford his insulin and died as a result. So there are not clear solutions right now, and that's what we're working on here at the legislature.
I'd like to turn now to vaping. Last week we had Senator Carla Nelson on the program. She is a proponent of measures that would raise the age to purchase tobacco to age 21 and also get rid of those kid-friendly vape flavors. Her legislation has bipartisan support. So I'm wondering if you agree with that approach in terms of getting a handle, especially on the teen vaping that is really on the rise.
So Shannon, this is very personal to me. I have 5 children. They're all teenagers, age 15 to 20, and they have described to me this explosion in vaping at their high school. And it's a real problem. The number of students who vape are escalating rapidly. At the hospital, we see people come in with severe lung injury and sometimes death And if they avoid that outcome, then these teens are hooked for life for the next 60 or 80 years of their life on nicotine products. Raising the tobacco age to 21 is a good proposition. I have co-authored that bill with Senator Nelson, and I will continue to support it. Eliminating flavors is clearly an essential step here. Flavors are how students and teens are getting hooked on nicotine vaping, and if we eliminate the flavors, we will make some significant progress in that regard. Shannon, lastly, I've authored a bill which would create a tax on pods. Pods are these little cassettes that go into the vaping device and allow people to vape.
And they're available at gas stations and tobacco supply stores all over the state.
They are, yeah. And we proposed a $2 per pod tax. We know that the youth market in particular is extremely sensitive to economic incentives, and raising the price, by any amount causes a correlation decrease in tobacco use among youth. So I am going to continue to push for a $2 per pod tax on vaping products, and I think that might be the most effective solution to moving us towards decreased youth vaping road.
Making it more expensive, getting rid of those kid-friendly flavors, and then also raising the age limit certainly would limit the access for those kids. So as a doctor, a parent, a lawmaker, you've said you're very concerned. Beyond those measures, like what do you say to kids? What do you say to parents who maybe have a kid who's been vaping? What's that conversation?
It's really tough. So there's the pod market that is Juul and other manufacturers that people can order online and so forth. And then there's this whole sort of open device market where you can go to a vaping store and just buy a bucket of liquid and then insert it in your own device. And that is where we're getting into real serious health problems. That stuff is unregulated and unmonitored. Sometimes it contains, other recreational drugs, and it's clear that some of the byproducts of what's in those liquids is creating some of these cases of severe lung injury and in some cases death. So those products in particular are fearful, and I try to counsel my kids to stay away from them.
Senator Matt Klein, thank you so much.
Always a pleasure, Shannon. Thank you.